strategy to address suicide and to help make progress in this important issue. And last week in the 75-minute debate, government MLAs spoke against the idea of supporting a strategy to address suicides in Saskatchewan. Why won't the Minister of Health develop and implement a strategy to prevent suicides in our province?
I recognize the Minister of Rural and Remote Health.
Mr. Speaker, suicide and the loss of life to suicide is a very serious issue that I know all members of this Assembly take very seriously. Mr. Speaker, and I don't know too many members around this floor that maybe haven't been touched by it personally. Mr. Speaker, we do have the Mental Health and Addictions Action Plan, which I would point out 42 of the 46 recommendations are either enacted or in the process of being acted upon. Mr. Speaker, a lot of them involving suicide prevention. We know the panel report that was done for the Single Health Authority transition spoke to a lot of services to be delivered around the province, whether in urban or rural, some of them involving suicide and mental health and addictions, Mr. Speaker. We know a Child Advocate report focusing mainly on children's suicide in the north is something that we accepted all the recommendations, whether it's working with the FSN with their strategy, the Métis Nation with their strategy, Mr. Speaker, or enacting things like Jordan's Principle, which the advocate pointed out, which we did in 2010, Mr. Speaker. We look at our health funding. We've increased our health funding by about 60% over the last 10 years, equitable amount going to mental health and addictions, which involves our suicide prevention. We've committed it publicly on the floor here, moving our provincial spend from 5%, moving towards a 7%, and also expanding some of those mental health services through other ministries.
Recognize the member for Cumberland.
The government always says there's more work to do on this file, but they have been in government for more than a decade, and they still haven't implemented a strategy. Children and families in the north, all across this province, are looking for the government to move beyond talk and commit to real action. The FSIN has released their strategy, and they noted that the rates of suicide among First Nations is more than 4 times higher than the rest of the province. And for First Nation girls, the rate is more than 29 times higher than the rest of the province. Why won't the Sask Party government work with FSIN, work with stakeholders to develop a strategy to prevent suicides in our province?
Recognize the Minister of Rural and Remote Health.
Mr. Speaker, we look at what many advocates will talk about when it comes to the suicide prevention strategy: awareness, education, needs of the high risk. Mr. Speaker, I can point to multiple initiatives through this government, through multiple ministries that do address many of those different approaches, Mr. Speaker. The member opposite talked about the FSIN strategy. Well, I would point out that Minister of Health and myself have a number of times met with Vice Chief Pratt to discuss the FSIN strategy. And if we look at that strategy, Mr. Speaker, we note that it calls on the needs are to be implemented not only at provincial and a national, but also at the local level, Mr. Speaker. So the leadership within the FSIN realize that there is some responsibility that we all share. When we look at some of the recommendations by the FSIN strategy, Mr. Speaker, we see a lot of them have been enacted through their provincial strategy. Of course, there's more work to do, and we're working with our FSIN partners and Métis partners and other partners throughout the province to implement those strategies to make an effective system that is very accessible by those in need of service, Mr. Speaker.
Recognize the member for Saskatoon Riversdale.
Across the board, this government is falling short on supporting people struggling with mental health and addictions issues. RUH in Saskatoon was over capacity by 98 people this morning, an issue that has persisted for years. So has the shortage of mental health beds in the Dubé Centre, which is leaving people in mental health crisis waiting in emergency rooms or staying in the ECT suite in the basement. These aren't appropriate spaces for people who are acutely sick, and this government knows it. And despite knowing that Dubé Centre has been chronically over capacity for years, this government has sat on their hands while people needing urgent mental health care struggle to access that care. We know that when people who are struggling reach out for help, it needs to be there. When will this minister get people in mental health crisis out of the emergency room and out of the basement and get them the care that they need?
As the Minister of Rural and Remote Health.
Mr. Speaker, we've, as a government, have done a lot of work towards in this regard, Mr. Speaker, whether it's even some of the recent activities when announcing some of the police and action crisis teams throughout the province. We know Regina and Saskatoon have them, recently announced in Prince Albert, North Battleford announcements coming, and Yorkton announcements coming, Mr. Speaker. So we're enacting multiple different approaches to help those access services as quickly as possible. We did hear about in the debate last week about 811, although I've multiple times said it's not a stopgap. It's a very quick service, accessible to those in need of services very quickly to be directed towards areas that they might need. Mr. Speaker, members across are very aware of the emergency system that's right adjacent to the emergency area in RUH right now that can assess and treat and direct people to services very quickly, as well as the Jim Pattison Children's Hospital. Some of the services be available in there, and we've talked about the Dubé Center services that are there. We also know that those that are less acute, that don't need the acute services in the Dubé Center, where some children will be accessing services of the professionals nearby, they will be able to access minor services throughout the Jim Pattison's Hospital.
Recognize the member for Saskatoon Riversdale.
That assessment unit at RUH is a nice emergency room, Mr. Speaker. It is not a treatment center, and this is a government who didn't add new dollars for that. They made them take resources out of other parts of mental health and addiction services, Mr. Speaker. The current overcapacity arrangement, where acute psychiatric patients are placed in the basement of the Dubé and moved around throughout the day, simply isn't sustainable. We know there are 10 child and youth mental health beds in the Dubé Center, and kids in this unit will be the only sick kids without a space in the new Children's Hospital. We know there is a desperate need for more adult beds, and we also know that having children and youth with mental health challenges isolated from other sick kids only perpetuates the stigma we all need to be fighting. Will this government recognize excluding kids with mental health issues from the Children's Hospital was a mistake, repurpose Dubé's youth beds to accommodate adult demand, and create a psychiatry unit for sick kids in the Children's Hospital?
Recognize the Minister of Rural and Remote Health.
Mr. Speaker, I don't propose myself to be a mental health expert. That's who we're relying on for these services and to direct us where these services should be, Mr. Speaker. In my previous answer, I pointed out, in consultation with these experts, they pointed out that these children that are really acute, that need these mental health supports that are very acute, it's better to be served at Dubé Center where the professionals are, Mr. Speaker. Services can be accessed by some children who need less acute services in the Jim Pattison Children's Hospital. We've been made aware of that. But, Mr. Speaker, to say that money was taken out of the mental health budget, the health budget, to direct towards that facility is wrong, Mr. Speaker. We were told there was unused funds within the budget were directed in that area, Mr. Speaker.
The member for Saskatoon Newtown.
Mr. Speaker, last week the Minister of Agriculture said